Since this was Mental Illness Month and I am interested in mental health research and alternative medical research, I found this article people might find interesting. Anyone that has seen my previous videos knows that I and some of my family members have been affected by mental illness. Depression and other mental health problems are at epidemic levels, judging by the number of antidepressants described each year. According to the CDC data, 20 Americans over the age of 12 report some form of depression, and 11% of the United States population over the age of 12 is on some type of antidepressant medication. And this is despite the overwhelming evidence showing that antidepressants do not work as advertised. At best, antidepressants are comparable to placebos. At worst, they can cause devastating lifelong side effects, including deterioration of the brain, more serious mental illness, and suicidal or homicidal tendencies. Almost all of the recent school mass shootings, for example, have been on antidepressants or antipsychotics that are also prescribed to the mothers during their pregnancy, which can have serious repercussions for the child. And having medication prescribed to the pregnant mother, I find, is inexcusable by the medical community, just like my last video about babies developing diabetes in the mother's womb by the selfish ignorance of mothers, parents, and the mainstream medical community. They're killing the baby and harming it so it cannot have a proper chance at life. And I believe that is a God-given right that has been taken away. Research also shows boys with autism are 3 times more likely to have been exposed to antidepressants known as selective serotonin and reuptake inhibitors, or SSRIs, in utero than non-autistic boys. Those whose mothers used SSRIs during the first trimester were found to be at a greater risk. Recent research into the mechanisms driving anxiety and social phobias now turn to conventional drug treatment with SSRIs as the first step. This turns out that these mental health problems are not due to low serotonin levels as previously thought by mainstream medicine. They are linked to high levels. If these findings are taken seriously, as they should be, mental health field should have a major overhaul. Now, recent research says that low serotonin theory was never proven true, yet spawned as a booming market of SSRIs. Prozac was released in 1987 in the US, giving rise to an entire new antidepressant therapy class known as selective serotonin reuptake inhibitors, SSRIs, and some of the most popular ones include Prozac, Celexa, Zoloft, Paxil, Lexapro, and Cymbalta. And I find it interesting that in my youth I was prescribed Cymbalta and have been taking it this drug in my use for several years, and who knows what long-term effects it has caused on me now. SSRIs work by preventing the reuptake movement back into the nerve endings of the neurotransmitter serotonin. This makes more serotonin available to use in your brain, which was thought to improve your mood. Most people have heard of the chemical imbalance theory, which states that depression and anxiety disorders are due to low serotonin levels. Most believe this theory to be true, but it's just a theory, and it's just that, a theory. It sounds scientific, but there was actually no hard evidence behind it. As explained in investigative health journalist Robert Whitaker in 1983, the National Institute of Mental Health investigated whether or not depressed individuals had low serotonin. At that time, they concluded there was no evidence and there was anything wrong with the serogenic system of a depressed patient. Research published in 2009 added further evidence to the pile, indicating that low serotonin idea was incorrect, and found strong indications that depression actually begins further up the chain of events in the brain. Essentially, the medications have been focusing on the effect, not the cause. Drug companies will keep running with the low serotonin theory as it justifies the aggressive use of making money off of antidepressants to correct this alleged imbalance. Now, a recent Swedish research study throws the justification for using SSRIs to treat anxiety disorders into question. Anxiety linked to high serotonin levels, making SSRIs a questionable remedy. More than 25 million Americans report suffering from some sort of social anxiety disorder, which makes them feel embarrassed or severely uncomfortable in public situations. As with depression, low serotonin has been the prevailing theory for explained social anxiety, and hence prescribing SSRIs as the typical response for patients that have this disorder. Other commonly prescribed anti-anxiety drugs include benzodiazepines such as Xanax, Valium. These are also associated with serious risks, including memory loss, hip fractures, addiction among women who take SSRIs to counter symptoms of menopause. The drugs can significantly elevate the risk of bone fractures, and this risk will linger for several years. One recent study found that compared to women treated with H2 antigens or protein pump inhibitors, ingestion drugs, SSRIs raise bone fracture rates by 76% in 1 year. After 2 years of treatments, the fracture rate was 73% higher. People who take these drugs are nearly 4 times more likely to die prematurely than people who don't, and also have a 35% greater risk of cancer, as reported by Medical Daily. Dr. Thomas and Dr. Matz Two other professors of psychology questioned the underlying hypothesis of treating patients with SSRIs. What molecular role exactly does serotonin play in social phobia? They questioned. To discover the truth, they used brain scanning technology, PET scans, to measure serotonin in the brains of volunteers with social phobia. Communication with the brain works like this. Nerve cells release serotonin into the space between nerve cells. Then serotonin attaches itself to a receptor cell. Following this, serotonin is released from the receptor and returns into the original cell. Our researchers discovered patients with social phobia were producing too much serotonin in the amygdala. This brain region, tucked deep inside our skulls, is the seat of our most primitive emotions, including fear. The more serotonin produced in this area, then the more anxious people feel in social situations. There have been other studies that have been released that increased nerve activity in the amygdala is part of the underlying mechanism that produces anxiety. Basically, those with sociophobia have an overactive fear center. These new findings provide new additional information suggesting increased serotonin production in the brain may be part of this mechanism. Either way, when it comes to treating anxiety disorder, increasing serotonin in your brain with SSRIs will not smooth over your anxiety. It will increase it, making SSRIs a questionable treatment option. As some suggestions from this doctor that may help social anxiety disorder. One study found that fermented foods can assist the impact of your gut flora on your, and it affects your gut flora affects your brain. And this has been confirmed by a number of studies and research moving rather swiftly in alternative medicine. One of the reasons for why bacterial makeup of your gut would have an influence on your mental and emotional health relates to the fact that the gut actually works like a second brain. Your central nervous system, composed of your brain and spinal cord, and your intrinsic nervous system of your gastrointestinal tract are created from identical tissue during fetal development. One part turns into your central nervous system, while the other part diverges into your gut nervous system. These two systems are connected via the vagus nerve, the 10th cranial nerve that runs from your brainstem down to your abdomen. It's been well established that the vagus nerve is the primary route of your gut bacteria used to transmit information to your brain. Even more interesting, serotonin produced in your gut as well as your brain by specific bacteria. In fact, the greatest concentration of serotonin is found in your intestines, not your brain. This doctor finds it not surprising then that researchers keep on finding positive correlations between gut health and improved mental health. Most recently, researchers found that fermented foods and drinks help curb social anxiety disorders in young adults. The study was published in Psychiatry Research, involved 710 psychology students at the College of William and Mary. The participants filled out questionnaires rating their level of worry and anxiety and documented their fermented food consumption over 30 days. Other factors such as healthy diet and exercise were also addressed. Among those who rated themselves as having a high degree of feeling eating more fermented foods was linked to fewer symptoms of social anxiety, meaning the relationship between fermented foods and decreased social anxiety was strongest amongst those who tend to be more neurotic. Some other key factors of overcoming anxiety or depression without drugs. It is important to realize that your diet and general lifestyle are foundational factors that must be optimized if you want to resolve mental health problems such as depression or anxiety, because your body and mind are so closely connected. Compelling research demonstrates just how interconnected your mental health is with your gastrointestinal health. For example, while many think their brain as an organ is in charge of their mental health, your gut may actually play a far more significant role. The drug treatments available today for depression are no better than they were 50 years ago. It's clear we need a new approach, and your diet is obviously a place to start. Research tells us that the composition of your gut flora not only affects your physical health, but also a significant impact on your brain function and mental state. So people should consider addressing diet and lifestyle factors before you resort to these SSRIs and other types of drugs. Some other suggestions this doctor has is drastically decrease your consumption of processed foods, particularly fructose, grains, and GMOs. High sugar and starchy carbohydrates lead to excessive insulin release, which can result in falling blood sugar levels or hypoglycemia. In turn, hypoglycemia causes your brain to secrete glutamate in levels that can cause agitation, depression, anger, anxiety, and panic attacks. Additionally, sugar fans the flames of inflammation in your body. In addition to being high in sugar and grains, processed food also contains a variety of additives that can also affect your brain function and mental state, especially MSG and artificial sweeteners such as aspartame. There's a great book on the subject called The Sugar Blues, written by William Duffy more than 30 years ago, that dives into the topic of sugar and mental health in more detail. There's also other recent research that shows that glyphosate, which is used in large quantities on genetically engineered GE crops like corn, soy, and sugar beets, limits your body's ability to detoxify foreign chemical compounds. As a result, damaging effects of these toxins are magnified, potentially resulting in a wide variety of diseases, including brain disorders that have both psychological and behavioral effects. Another tip is reducing gut inflammation. It's imperative when addressing mental health issues, so optimizing your gut flora is a critical piece of the puzzle. To promote healthy gut flora, increase your consumption of probiotic foods such as fermented vegetables, kimchi, kefir, and other fermented foods. He also recommends that you get an adequate vitamin B12. Vitamin B12 can contribute to depression and affects 1 in 4 people if you have a vitamin B12 deficiency. Another tip he has is optimizing your vitamin D levels. Vitamin D is very important for your mood. In one study, people with low levels of vitamin D were found to be 11 times more prone to depression than those who had normal levels. Remember, SAD, seasonal affective disorder, is a type of depression that we know is related to sunshine deficiency, so it makes sense that the perfect way to optimize your vitamin D is through sun exposure or a UV or tanning bed. If neither are available, you can take supplements of vitamin D3. Probably one of the most important tips he has is your brain is 60% fat, and DHA, an animal-based omega-3 fat, along with EPA, is crucial for good functionality and mental health. Research has shown as 20% of a reduction in anxiety of medical students taking omega-3s. Unfortunately, most people don't get enough from diet alone, so make sure that you have a high quality omega-3 supplement. And just as a personal notice, I remember from my youth, my mom was into the low-fat craze, and I'm pretty sure that could have played a factor in the things that I have to deal with today. Another tip is to evaluate your salt intake. Sodium deficiency actually creates symptoms that are very much like those of depression. Make sure you do not use processed salt, regular table salt, but you want to use all natural unprocessed salt like Himalayan salt or sea salt that contain different micronutrients. Another tip is get adequate daily exercise. Exercise is the most effective strategies for preventing and overcoming depression studies have shown that it is strong correlation between improved mood and activity. So there's a growing acceptance that the mind-body connection is very real, and that maintaining good physical health can significantly lower your risk for developing depression in the first place. Exercising creates a new GABA producing neurons that help induce a natural state of calm. It also boosts your levels of serotonin, dopamine, which helps buffer the effects of stress. And I'm sure everyone can use more of this. He recommends that you get enough sleep. You can always have the best diet and exercise program, but if you aren't sleeping well, you can easily become depressed. Sleep and depression are intimately linked. That a sleep disorder is actually part of the definition of this symptom complex that gives the label depression. And this next tip is something recently new. It's called energy psychology techniques, such as emotional freedom technique or EFT, can also be effective for reducing anxiety by correcting the bioelectrical short circuiting that causes your body reactions without adverse effects. You could think EFT as a tool for reprogramming your circuitry. It works both on stressors and possibly damage that is caused from the stress. EFT is a form of psychological acupressure based on the same energy meridians used in traditional acupuncture for more than 5,000 years to treat physical and emotional ailments, but without invasive procedures or toxic drugs. Recent research has shown EFT significantly increases positive emotions such as hope and enjoyment and decreases negative emotional states including anxiety. EFT is particularly powerful for treating stress and anxiety because it simply targets your amygdala and hippocampus, which are parts of your brain that help you decide whether or not something is a threat. EFT is a powerful tool and has also been shown to lower cortisol levels. Although you can learn the basics of EFT on your own, it's recommended that you start with a qualified EFT practitioner and especially for those people with serious health problems. I also like to add another tip that this doctor left out is meditation. Meditation is very powerful. It is like brain repair, and it helps me escape the world when I need to. There are many situations where SSRIs will be warranted by the mainstream medical system, but on the whole, these mind and body numbing drugs are grossly overused, and I'd be willing to bet the majority of people taking them are not appropriate candidates. It can also find help with some of these natural, non-invasive tips that I listed and what this doctor listed. I'm sure they would fare much better if they were to address the basic core issues relating to their general lifestyle and health, and that includes the proper diet, sleep, exercise, and employing effective tools for stress relief, exposure to the outdoors such as walking barefoot through a grassy field and getting appropriate amounts of sun exposure also should not be underestimated. If you're suffering from emotional or physical pain, I encourage you to pursue other articles which address the issue of vitamin D issues and other alternatives. And I find this somewhat positive and negative article. At least there are some doctors that are providing this type of information. I realize that toxic drugs should be one of the last options and never to be given to pregnant women or children, for we're just now starting to see the damage this has caused to the children of today, and who knows what the long-term damage we'll see if we continue drugging everyone.